I'm Kevin Klein. It's Friday night, the start of a long weekend and the end of a very productive week for me. I had the opportunity to meet with many residents and small business owners from our ward and across Winnipeg and listen to what they feel are the priorities for our budget. Very interesting to see the difference between what council thinks are the priorities and what residents who are paying for it feels are the priorities. And I hope to have more and more of those meetings as time goes along. If you have a group, I would love to meet with your group and talk about your priorities for the city of Winnipeg. Maybe it's the budget, maybe it's infrastructure, whatever it might be. I'd like to hear your priorities. I think it allows me to better serve residents. So call me or email Kevin at kevinklein.ca. Two motions I put forward this week were unanimously supported. I'm very, very pleased with that, and I'm very grateful to my colleagues who supported these motions. The first is for ambulances. Now, what I've asked for is an independent review on the wait times for ambulatory service in the city of Winnipeg. The city of Winnipeg takes care of the ambulance services, but it's a full pay program from the province of Manitoba. And during the last 7, almost 8 years now, the city of Winnipeg has not really made any effort to bring on more ambulances. Our population has grown. Our city's footprint has grown. The need for ambulances has grown. But we haven't done the work necessary. We haven't managed the system properly. So I'm calling for an independent review of the wait times, because here's what I'm hearing. I heard this from a member of the service. I don't want to say who it is because they're always fearful for the job, and I would never do that to anybody. But we had, in the last week, 6 units, 6 ambulances sit idle. 6 shifts, evening shifts, idle with these ambulances because we didn't have staff to put in the ambulances. So on busy evenings, we're actually short an ambulance or 2. We already have a small number of ambulances that can't control everything. And now they're short because they're tired of working overtime. We don't have enough staff. And that is creating pressure on other areas of the city. It's creating risks for you. I was told that a fire response crew, like one of our Winnipeg firefighting team, responded to a medical call. They always do. They're there to make sure they can stabilize the patient and take care of people. But they had to wait there with a patient who was stabilized for 4 hours. That's 4 hours. A fire truck sat at a residence with 4 firefighters on it, waiting for an ambulance. They had to stabilize the patient. They had to wait there for the ambulance to come, to ensure the safety of that patient, take care of that patient, its health. This is unacceptable. I started talking about this a couple of years ago when Chief John Lane brought forward the big plan for the Winnipeg Fire Paramedic Service with stations all over the place, but there was no mention, not one word about ambulances. We need an independent review, not a city review. We need fresh eyes to take a look at the issues. Why do we have these wait times? How do we fix these wait times? Give us some direction and some actions. The second motion was for Homes for Heroes. Now, this is an organization I have been working with for 2 years, trying to get them to bring their program to Winnipeg. They're in other cities right now, and I urge you to go to the website and check them out. homesforheroesfoundation.ca. We need this organization in our city. We have over 200 vets that are suffering from a mental health injury. And I say that because I spoke to vets and they don't like calling it PTSD. And some of them, many of the plus 200, are living on our streets. There are programs to help them. There's federal programs and veteran affairs programs, but they have difficulty getting to that stage or reaching out and asking for that help. And they have nowhere to live. They have no community. They're afraid. They're alone. Homes for Heroes is a solution. It helps our vulnerable population. It helps our veterans, women and men who put their life on the line for you and I. I want your help. I need your help. Push all levels of government. Push your city councilor. Push the mayor's office. Make it possible for Homes for Heroes to be here immediately. So that's why I put a motion forward, directing the public service to work with the Homes for Heroes Foundation as quickly as possible and find appropriate land for them to build their community. They're not looking for it free. What they build is over $4 million. That's what it cost. And they're willing to pay for the land. I think we could sell them the land for $1. But even if we didn't, even if they didn't want to do that, find them the land. Let's do it now. We can help 200 people, our vets. And it's a program that works. Please check it out, homesforheroesfoundation.ca. Anyways, too much for this video. We'll have another one tomorrow that we'll tape here in a couple of seconds and tell you about what else happened in the week. So enjoy yourself. Have a safe and happy long weekend.